I'm Cassandra and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. Breast cancer is a disease many know too well in the United States. It's one of the most common types of cancer found in women, accounting for nearly 1 in 3 female cancers each year, according to the American Cancer Society. In 2023, it's projected that nearly 300,000 women will receive a breast cancer diagnosis, and more than 43,000 will die from the disease. While those are sobering statistics, there is reason for hope. Screening for breast cancer and early detection can save lives. Screenings can help detect breast cancer at an early stage when the chances of survival are highest. In today's episode, we'll talk with experts about breast cancer risk and the importance of mammograms. We'll also hear the story of how breast cancer affected one family and inspired them to action. Joining us first is Dr. Honnie Bermas, a breast surgeon. Dr. Bermas, thanks for being with us. We appreciate it.
Thanks for inviting me.
Okay, so our first question as we jump right into this is breast screening recommendations have changed recently. Most people thought, starting screenings at age 50 was, the standard, and now it's changed to age 40. So why did those screening recommendations change?
In recognition of the fact that a significant number of women have breast cancer between the ages of 40 and 50, there was a lot of backlash saying that we should really be starting at 40. And so they recently changed their guidelines to say, yes, you should start at 40, and then maybe you should do mammograms every other year. But I think that there's some recent requirements for breast centers of excellence that they do a risk assessment for every woman coming through the breast center. So anyone having screening or diagnostic imaging would have a risk assessment, so every woman will know her risk. And that level of risk will drive screening recommendations for her.
Okay, and that was going to be my next question, this breast cancer assessment or breast cancer risk assessment. What goes into that, and when should women start, and what kind of knowledge does it provide?
So it's been a somewhat haphazard affair for a long time, meaning that if you were referred for a high-risk clinic, you underwent risk assessment, which means that the provider would take into account your risk factors, including your mammographic density and your family history and your reproductive risk factors, and would calculate your average risk of breast cancer compared to an average woman in America. But that was only if you were referred to a high-risk clinic. So now ThedaCare is a part of an organization called the NAPBC, which is an organization that's sponsored by the American College of Surgeons for sort of breast centers of excellence. And one of the requirements is that every woman who comes through the breast center, either for screening or diagnostic, which is a problem-solving mammogram, have risk assessment. So now everyone will have it on a population basis.
So for many years, women have been recommended to do some self-breast exams. Now that's changed to self-breast awareness. What's the difference between the two, and what should women know?
I think it's become quite clear that breast self-exams are actually not all that reliable for picking up cancers. For example, in a trained provider, what's called a clinical breast exam, so by your doctor or someone like me who's a breast specialist, it's quite clear that my ability to pick up a breast cancer on exam is about 50%. So reflecting that very low level of accuracy, breast self-exam in a very sort of cut and dry sort of way, same time every month, has really been discouraged. And so what's become quite clear is that, women are pretty good at picking up a problem just in sort of their daily lives. So when they shower and they soap up, or if they're looking at themselves in the mirror, they're likely to see something at about the same rate that they would find it if they were aggressively doing a breast self-exam. But generally speaking, the best way to pick up a cancer is screening mammography.
Okay. A lot of women might feel nervous about getting a mammogram. They might be afraid of what the outcome would be or just the process itself. What do you tell women to help reassure them and empower them to get screened?
My approach tends to be I'd be much more afraid of an advanced breast cancer than I would be of a mammogram. So I usually say to them, the earlier we can find it, the more likely we are to cure it. And so, the mammogram is usually quick and easy. Some women do have some discomfort with the mammogram, but I think in the scheme of things, it tends to be fairly minimal. And so I tell women, there's nothing else that can take the place of a good mammogram. Thermography can't, a breast exam can't. So really, I would say to them if the best thing they could do for their health is to have a screening mammogram as indicated by guidelines.
All right, Dr. Bermas, this has been really good information that you shared with us. We appreciate you helping us out. Next up, we are going to get a sneak peek of the new Women's Center at ThedaCare Regional Medical Center-Neenah. This space was designed to be comfortable, to help women feel empowered as they make those personalized healthcare decisions. So joining us to give us a tour is Christy Brennan. She is the imaging supervisor at ThedaCare. Christy, thanks for showing us this new space. We can start right here in this area. Tell us why it was really designed to be spa-like.
Absolutely. Thanks for being here. We wanted to create a welcoming and calming place for our patients. Having a mammogram can be a scary and a stressful time for a lot of patients. So being able to come into a space that is calming and relaxing to help ease women's fears of having a mammogram.
And it truly does feel like a spa. Some of the features here really don't make it feel clinical or feel like you're in a hospital.
Absolutely, and that's really what we wanted to do for our patients. We've got a volunteer that is here to welcome our patients as they come in. We've got a refreshment corner for complimentary beverages as patients are here, and it overlooks our beautiful courtyard as well. So it's really a beautiful space.
It really is very relaxing. Really great features that help women feel comfortable, and some other smaller details like the artwork on the walls.
Yeah, we have this beautiful artwork that was donated to us from Mrs. Bergstrom. It's absolutely gorgeous, and coincidentally, it matches our color scheme here.
Like we said, those small details. Yeah. All right, let's take a look here at the next stop. So as I'm walking through here, we notice little features like a brick wall. And you wouldn't think a brick wall is significant, but it has quite a story to tell.
It's one of the original walls from the hospital from 1948. And we really wanted to leave it here to honor Theda Clark Peters. Her legacy of being able to help people and provide local and high quality care for the community lives on, and it's a visual for everyone to see over 100 years later.
And it really speaks to her generosity of helping begin ThedaCare's history and legacy in our communities.
Yes.
Okay, let's keep going. All right, next part of our tour, the mammography pods. Really unique space, truly designed around the patient.
Yeah, absolutely. So we wanted to create a space that was private for our patients. We've got these sliding doors. So each pod is completely closed off. We've got changing rooms right here where patients can change into their robe for the exam. The patient comes from the changing room into the exam room, never has to go down an open hallway in their robe. So it's very comfortable for the patient.
And right, I mean, before, when you think of other spaces, people might have to walk around in a robe, going from one place to another, not in this space.
Not in this space. So that's what we wanted to do, just create it so that it was completely closed off from all the other patients and the other staff members.
Perfect. All right, let's go check out the actual exam space. Okay, so now we are in the actual exam space. What goes on in here?
So this is where the technologist will bring the patient in, do a history. They'll also do their mammogram in here. It is private along with the pod here. They're listening to some nice spa-like music because it is a very stressful time. And, you know, we want our patients to have a wonderful experience throughout.
It sounds great. Again, Christy, thank you for taking us through this tour and explaining the process for us.
Absolutely. Thank you.
We know that for many women, having a yearly mammogram may seem like an unpleasant task. To walk us through this is Miranda Parson, a mammography technologist at ThedaCare Regional Medical Center-Neenah. Miranda, thanks for being with us.
Thanks for having me.
Okay, so we are going to play a game of myth versus fact. We're going to talk through some of the misconceptions that women may have when it comes to having a mammogram. So we'll give you this board.
Thank you.
And ask you some questions to get us started. Okay, the very first one is that any woman can benefit from having a 3D mammogram.
Yes, and that is a fact. Any of our patients getting a mammogram would benefit from having a 3D mammogram. So the 3D mammograms do have an increased cancer detection rate, and they take clearer pictures. So it's really beneficial for patients, especially with denser breast tissue.
Our next statement is that mammograms are painful.
I'm going to say myth. They should be uncomfortable, but not painful. So what I tell patients usually when they come in for their first mammogram is it should be uncomfortable, but not unbearable, but tell me when to stop with compression. And the pictures are very quick. They range from usually but 4 to 7 seconds, I would say.
Oh, okay.
So it's a quick process.
So maybe uncomfortable for just a small amount of time.
Exactly.
Okay. So next statement here is that you should tell your technologist in advance if you have breast implants.
That is a fact. Yes.
So at the beginning of each exam, we do ask patients for their medical history, and we go over their surgical history as well. If they've had any breast or chest surgeries, we do encourage them to let us know. It does change the exam slightly. Patients with breast implants do have exams that take just a little bit longer because we're doing some extra pictures to include all the breast tissue.
Okay, but again, you want the best possible screening that you can get.
Exactly. So the more information we can get about their history, the better the pictures.
Okay. The next one that we have here, something that might have been floating around, is that maybe mammograms cause cancer.
Myth. So mammograms do use a very low dose of radiation, but it is something the benefit of the mammogram outweighs the risk.
Okay. All right. Our next one here is that most insurance plans, something like Medicaid, Medicare, they cover screenings for a mammogram.
That is true. Medicare and Medicaid do cover screening mammograms, as well as a lot of other insurance companies. If the patient is unsure on if their specific insurance covers the 3D mammogram, we do encourage them to call before the exam just to verify.
Okay. And as we understand the importance of having a mammogram, what are some words of advice that you can give to women as they are getting themselves ready for it?
Sure. So we do ask that you don't wear deodorant day of if you can. We ask that you wear a two-piece outfit. So our gowns are t-shirt gowns. They don't go all the way down. So you're only undressing from the top up. And we'll walk you through the whole thing and you'll be fine. We'll take good care of you. So if you're nervous, just let your technologist know and we'll work with you.
All right, Miranda, really good tips and explanations. So we really appreciate your time.
Thank you.
To close this episode, we want to share the story of Trina Reynolds. Trina was diagnosed with breast cancer and passed away of the disease in 2011. During her journey, she wanted to help other women battling breast cancer, and that inspired her to establish a fund to help others get the best possible care. We sat down with her daughter Hillary to talk about her mother's legacy and the impact it's having right here in the Fox Valley.
I think it's very easy to see the pink ribbon and just kind of be like, oh yeah, breast cancer is the pink ribbon. And there's just so much that we can have a dialogue about as a community to continue to push other women to get the care they need. My mom was Catherine, but everybody knew her as Trina. She was a spitfire and not a subtle woman by any means. If she loved you completely, and she made a lot of noise wherever she went. She saw the deep need to help women who were in her position, who maybe didn't have the financial capability to get to where they needed to go in order to advocate for themselves.
When we have over 36,000 to 40,000 mammography tests every year, that means that 10 to 15,000 women need to learn very specifically what that path may need to be. And Trina Fund has now empowered us to be able to deliver videos that tell very specifically what path you need to take based on your diagnostic results and your risk score, so that ultimately we are helping our patients to lead their best lives in the way they need to with the most updated information.
We need to be able to have women feel more powerful and more confident in their care. There's always a vision to do more and to help more. Right now, I just want more women to know that it's available. I just want more women to know that help is there if they need it, to find that strength, inner tenaciousness, and fortitude to stand up for yourself. That is something that I carry forward.
We hope we've empowered you with the tools and information you need to take care of your health. Remember, the need to watch over your breast health extends beyond October and Breast Cancer Awareness Month. Make breast self-awareness a regular practice, and if you're due for a mammogram, don't delay scheduling. Log into My ThedaCare to make an appointment today. Thanks for watching. At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below. And be sure to like and subscribe so you see the very latest in this series.